how are you? Okay? Does your knee hurt?
Yeah.
Your knee hurts?
Yeah.
You're fine. You don't have to move at all, okay? I'm just taking a picture of your pretty room.
It might appear that this is simply a woman sitting alone in her room, but there is more to it than that. Even though she can't walk and can't talk, this woman is telling us something about how she feels and what she needs. She is communicating, the only way she can, that she is in pain. Most older adults, including those with dementia, are in some degree of pain on a daily basis. But people with dementia who are in pain can't tell us how much, what kind, or where at, except by their behavior.
Inez, take your hand out of your mouth for a minute. I'll give you some Tylenol. That'll make your teeth feel better.
The best pain medication to start with? Tylenol in capsule or liquid form, given routinely. We can't count on a person with dementia to tell us when it is needed. Consider that there may be pain on a daily basis and treat it on a regular schedule. This will work most of the time for most people.
Take a drink.
If it doesn't, step up to a combination drug such as Tylenol with codeine or Percocet. Again, use it routinely for several days before moving on. Only a small number of people will have such severe pain that they need small doses of an opioid on a routine basis. Pain is not always the cause of agitation, but it is something to think about and address first.
It's a squirrel.
Is that a squirrel?
If treating pain is ineffective in addressing the agitation, could depression be a factor? People with dementia generally can't say, "I'm depressed." But if they are tearier or wearier than usual, an antidepressant can often help.
50% of people with Alzheimer's have some kind of significant behavioral problems at some point in that course. They hallucinate, they believe things that aren't true, they have become delusional, they become aggressive, they become sexually acting out. Another 50% don't ever have those things.
If pain medication and/or antidepressants are inappropriate or ineffective, if severe agitation is distressing to the patient or potentially harmful to a caregiver, or if agitation is accompanied by delusions, paranoia, or hallucinations that are distressing to the patient, then an antipsychotic such as Haldol, Risperidol, Zyprexa, or Seroquel is the treatment of choice. What about those other prescriptions you're likely to find in the medicine cabinet or maybe on the med cart? You know, the popular drugs of our day, Ativan, Benadryl, Valium, Xanax. In general, Ativan, Restoril, Valium, and other benzodiazepines should not be used for people with dementia. This class of drugs increases confusion, increases falls, and frequently increases agitation. Another family of drugs to avoid are anticholinergics. These drugs work to lower the levels of acetylcholine, which are already lowered by Alzheimer's disease. Common anticholinergic medications include some tricyclic antidepressants, Benadryl, Bentyl, many common cold medicines, and many over-the-counter sleep aids. These drugs are likely to cause increased confusion, constipation, urinary retention, dry mouth, and palpitations in all older adults, particularly those with dementia. Family members are often concerned and exhausted when restlessness keeps their loved one from a good night's sleep.
The last few months, it really got bad because I wasn't sleeping. I had to be up with her. I could put her to bed and she'd be up in 10 minutes, and I followed her around the house day and night.
She's over there sleeping.
In dementia, normal sleep patterns gradually disappear. Eventually, sleep will be intermittent through the day and night. There is no reason to use a medication for sleeplessness when the patient is in a good dementia care facility with 24-hour staffing.
You can get some rest.
But when the primary caregiver is on duty around the clock, a prescription sleep aid such as trazodone may be needed. Again, you will want to avoid benzodiazepines. They will cause paradoxical agitation, increased confusion, and more falls. Nor will you want to use over-the-counter sleep remedies because of their harmful anticholinergic side effects. And what about stopping the decline of dementia altogether? Despite the array of memory enhancement aids that might lead us to believe otherwise, there are no treatments that have been shown to prevent dementia or to stop it once it begins. Even dementia prescription drugs are far from a cure-all. Vitamin E might help to slightly delay decline, and it is relatively inexpensive. Anticholinesterase inhibitors such as Aricept, Exelon, and Remenil might help slow decline for mild to moderate dementia. Memantine is the newest drug to be approved. It is used for moderate to severe dementia.
He was on a new medication, Memantine, that he told everybody he was going to defeat that Alzheimer's and that he was going to buy him a new truck and drive again.
Unfortunately, the best medications available work for fewer than half of all patients with dementia. And when they do work, the course of the disease is only slightly slowed, by about 6 months.
And I could just see, of course the steps aren't solid, you still have this and go to that, but I could just see the progression. And he could see it, but he was in denial until, as I say, the very final, then he'd say, I'm not going to defeat this, am I?